So, could your next dietitian actually be an algorithm? It sounds like science fiction, but it's closer than you think. Today, we're taking a deep dive into how artificial intelligence is set to completely change the world of nutrition, from its incredible promise of perfectly personalized diets to the really serious challenges we have to solve first. All right, let's just start with one number that puts this whole conversation into perspective. 40%. Right now, about 40% of adults around the entire world are considered overweight or obese. And look, that's not just a statistic, it's a massive public health crisis, and it means we desperately need new, better solutions. So here's how we're going to break it all down. First, we'll look at the scale of the weight problem. Then, we'll explore AI's promise for true personalization. After that, a much-needed reality check on the challenges. Then, we'll get into a blueprint for building AI we can actually trust. And finally, we'll ask the big question: what does this all mean for the future of nutrition? You know, that 40% figure we just talked about, it's so much more than just a number on a scale. It really represents a global health crisis that has huge consequences, not just for people's well-being, but for our entire healthcare system. And the stakes here are incredibly high. These conditions are directly tied to some really serious health risks, things like type 2 diabetes and heart disease. But here's the crucial part, the hopeful part, really. Studies show that even a small weight loss, just 5%, can dramatically lower these risks. And that's exactly why the hunt for better, more effective tools is so darn urgent. And that leads us right here to AI's personalized promise. We're finally starting to move away from those old one-size-fits-all diet pamphlets and into a brand new era where nutrition advice can be tailored specifically to you. This slide really just lays it all out, doesn't it? On one side, you've got the old way, generic, rule-based, and almost impossible to scale up to help lots of people. But on the other side, you have AI-powered plans. They're driven by data, they're dynamic, and they can offer a level of personalization to millions of people that was just unimaginable before. This is where things like large language models, yeah, the same kind of AI and those smart chatbots, come in to create new and creative suggestions just for you. So, how does this actually work? Well, you can think of it as a continuous feedback loop. It all starts with data. Everything from your smartwatch to pictures you snap of your meals, even your genetic makeup. The AI then crunches all this different data to give you personalized recommendations. But, and this is key, it doesn't stop there. The system learns from your feedback, from your results, and it's constantly tweaking and refining its advice. And this is the magic of what's known as multimodal AI. I mean, just imagine this. The AI doesn't just see a photo of your salad. It connects that picture to your blood sugar reading from a sensor and your activity level from your watch. It's not just counting calories. It's weaving together all these different streams of information, visual, biological, behavioral, to build a complete holistic picture of your health. It's pretty incredible. But, of course, it's not that simple. Nothing this powerful ever is. For all of its amazing potential, AI in healthcare is facing some absolutely enormous hurdles. So it's time for a reality check on the very real challenges that are still ahead of us. Okay, so there are really three core problems we absolutely have to solve. First up, data bias. If an AI learns from data that isn't diverse, its recommendations might be inaccurate or even dangerous for certain groups of people. It's the classic garbage in, garbage out problem, but with huge health consequences. Second, there's the black box issue. A lot of these AI models are so complex that we don't know how they got to an answer. And if doctors can't trust it, patients won't either. And finally, privacy. I mean, these systems need our most sensitive health data, which opens up a huge can of worms about security and consent. And the challenges aren't just technical. There's also the human element. A fascinating recent study found that even though people liked the AI's personalized advice, they felt the conversation was, well, kind of robotic. It felt formulaic, not authentic. It's such a powerful reminder that having all the data in the world isn't the same thing as having real empathy. But here's the thing, that same study also gave us a real glimmer of hope. Check out this chart. Initially, the AI's messages were rated way less helpful than the humans. But after the researchers revised the AI based on feedback, its performance shot up, almost matching the human coach. So what this tells us is that AI has the potential to learn and get better, especially when we guide it. So how do we get there? Knowing the problems is one thing, but actually fixing them is the real challenge. The good news is researchers are starting to put together a clear blueprint for building trustworthy AI that we can all actually rely on. A huge piece of this puzzle is something called explainable AI, or XAI for short. You can think of it as the perfect antidote to that black box problem we talked about. XAI models are designed from the ground up to be transparent, so doctors and users can actually understand the reasoning behind a recommendation. It's about turning the AI said so into the AI suggested this because of A, B, and C. So, building on that, the blueprint for trust becomes pretty clear. It starts with using high quality, diverse data. It means building those explainable models we just mentioned. We absolutely need strong ethical rules and regulations. We need standardized ways of reporting on how these AIs are performing. And maybe most important of all, we have to keep a human in the loop, providing that essential oversight and judgment that only a person can. Which brings us to our final section, where we pull all these threads together. So, is an AI really going to take your dietitian's job? Well, the answer is almost certainly no. The real future is all about partnership. If there's one thing to take away from all this, it's this. Think of AI as a co-pilot, not replacement. It's a tool that can sift through mountains of data and give personalized insights at a massive scale. It's here to empower human experts so they can do their jobs even better, help more people, and focus on those uniquely human things like building trust and motivation. So here's the bottom line. The potential for AI in nutrition is without a doubt immense. It really does promise a future where truly personalized healthcare is available to everyone. But, and it's a big but, we can only get there if we are incredibly rigorous about testing these systems and making sure a human is providing oversight at every single step. That's the only way to make them safe, fair, and truly effective. And that leaves us with one final question to think about. As this technology keeps getting better and smarter, will your next health coach be a person, a sophisticated AI, or maybe more likely, a seamless partnership between the two? The answer to that is going to shape the future of health for every single one of us.